Well, again, good afternoon, everyone. It is so nice to have you with us as always. My name is Dan Worry. I am the Senior Director of Early Learning at the Hunt Institute in Durham, North Carolina, and it is a treat to have you with us. For the benefit of those of you who may be joining for your first webinar with us, the Hunt Institute is the creation of our founder and chair, four-term governor of North Carolina, Jim Hunt, and we serve as an education policy support to governors and state legislators and other high-level state elected leaders across the country. The Institute covers the full spectrum of education policy, beginning prenatally and on up through post-secondary and workforce. Today's session is focused around a very, very important topic: promoting equity within state child care systems. This is a topic that relates to some work that we have been very excited at the Institute to be partnering with our great partners at the Brady Education Foundation in Chapel Hill, North Carolina. We know that the COVID-19 pandemic has had very serious, widespread consequences for children and families, not only across the United States, but across the globe, and has led to unprecedented changes in the lives of many families. But the pandemic has also highlighted the fragility and the importance of the child care education and care system in this country. As states began to shut down child care and education programs closed, we saw unemployment rates obviously rise across the country, and a large number of early educators and the early childhood workforce themselves faced challenges with unemployment. Along with these factors came potential threats to equitable access to childcare in particular. And today we are and excited to welcome rather a panel of early childhood leaders from across the country who have been working very hard over the course of the past year to make sure that those access issues are not a case. So with us today to contribute to this discussion are Commissioner Beth Bai of the Connecticut Office of Early Childhood, Belvy Herbert, who is Social Services Administrator at the Delaware Department of Health and Human Services, and our friend Dr. Sarah Vanover, who's Director of the Division of Child Care for the Kentucky Department of Community-Based Services. So please, first, let me just say welcome and thanks to all three of you for taking time out to join in this conversation. Beth, I thought maybe we would start with you, but really maybe the same question initially to all three of you. We recognize the impact of the pandemic, but we also recognize the potentially positive impacts from the CARES Act and now more recent COVID relief dollars that are coming down to help to support childcare. So, Commissioner Bai, why don't I just open up with you and just ask about what is the impact that you have seen on equitable access to childcare in Connecticut, whether positive or negative, here over the course of the pandemic. I know it's actually seen it feels like many chapters in the story of the pandemic over the past year.
Yeah, Dan, it's a really complex, I think it's a really complex picture, and I so appreciate you having me, and I'm so happy to be on with Sarah and Belvy, and appreciate all that the Hunt Institute has done to support those of us out there leading. I don't think the early childhood field has ever been this connected, where virtually Sarah and I are on calls all regularly. The New England commissioners developed a plan together to address the grants to programs. So that's been a positive outcome of COVID. In terms of equity, it's sort of interesting what happened in Connecticut, and it may have been different in other states, but we never shut down childcare. So about 25% of centers stayed open and about 60% of family child care homes stayed open. And so, but what we saw was that the parents who lived in what we call our most socially vulnerable communities with the highest social vulnerability index, families there were most hesitant to send their children to child care. And so even when those child care centers tried to stay open, they suffered the most fiscal challenge at this time. The parents in many cases were still working, but they were very concerned about the health and safety of their children and what would happen. Meanwhile, in lower social vulnerability index communities, parents sent their children back sooner. And so there was a disproportionate impact on those program. So we had a program with our low-income state-funded centers where we gave a 25% bonus knowing they were hurting for enrollment on top of whatever their enrollment said. And we let them do enrollment by classroom, not by child. So we tried everything to bump up their reimbursement. The programs that even with 25%, even paying by classroom, those programs in our larger cities like Hartford, Bridgeport, Stamford, were just missing more than half of their population. Meanwhile, those parents often were working and having to scramble for childcare, but they did have the concerns about the health and safety. And I also think when the schools went to hybrid and were doing two different things, parents, if they had transportation challenges, couldn't get a little one here while they're home 2 days a week. And so I think the impact was disproportionate on the families and on the programs.
Interesting. Belby, weigh in and tell us a little bit about your experience in Delaware on the question of equitable access here over the past year. Belby, you're muted. Oh.
Okay.
There you go.
So, yes, I'm Belvy Herbert. I am the state's child care subsidy administrator. And so here in Delaware, we did not shut down our child care either. We allowed providers who wanted to provide child care for essential workers to remain open. They did have to apply to do that. They were trained on the nuances of operating under the pandemic, and they were required to follow the special guidelines. So we did remain open. And of course, as we know, essential workers had to continue to work. And so those folks were our cops, our police officers, and things like that. But then as businesses began to open, like restaurants and, the grocery stores were all open, and Walmart, those are typically our families that needed the child care, and disproportionately are, people of color or minorities. And so in our state, we never had a wait list for childcare or anything like that. And we did not get reports that, people were hurting for childcare. Now, one of the things I will say is that, people were not able to access childcare closer to their homes or communities. So that, was those were isolated issues, but those were the only issues that, we really had in Delaware. But in terms of that question, it's interesting because nationwide, we know that children of color are not accessing, at least child care subsidy in the way that their peers are. And so for our state, I would like to see, some hardcore research done in terms of our families of color and whether or not they actually have the access that we believe that they have. So that's kind of where we are in Delaware.
Great, Belby, thank you. Sarah, weigh in and talk to us a little bit about how this has played out in Kentucky.
Well, unlike Delaware and Connecticut, Kentucky did have a mandatory closure of childcare. And when that happened, centers were able to apply to be an emergency site to support families of essential employees. We had capacity for about 6,000 children in those emergency sites throughout the state. And we never really had more than 1,800 children enrolled. And like Beth said, if they had another option, they took it. If they didn't have to send their children to group childcare, they found it. Once centers were able to reopen, they still had a limited capacity that they had to work under for quite a while. In fact, that capacity limit has just recently been lifted. Prior to the pandemic, we had capacity in the state of Kentucky for 165,314 children in childcare. That number is like ingrained in my brain now. But since then, we have lost some centers and some family childcare homes. Some are still temporarily closed, waiting to get some of these funds, or some are temporarily closed because they're connected to a school district that might not be open yet. But most of our Kentucky providers have been so resilient, they have hung on and tried to provide care. But with centers closed, with limited capacity, access was an issue across the state. And we found that low-income families obviously had a challenge finding centers, because some of the centers that were open during the closures, they began to charge a little bit more because the staffing requirements were higher and the children coming in were lower numbers. And so we had to adjust our subsidy system during that time period to help cover that additional cost. Along with low-income families, we also saw shortages in rural areas. In Kentucky, there's a huge number of rural counties, and we always have more childcare concentrated in the urban areas, but particularly in far west and far eastern Kentucky, along Appalachian Mountains, things like that, access is already so limited. And then bring on the conditions of the pandemic, and that was another concern, as well as access for our families who have children with disabilities. You know, when you're talking about diversity and making sure everybody has access, those kiddos that have a disability, it's hard for them to find childcare, appropriate childcare, in the best of circumstances. But now put all these additional requirements on top of that. Centers were trying to meet the highest health and safety requirements, which they've done such a good job at, but that requires a lot of extra staff. And so you put those staffing requirements on, and then you have a child in the center with a disability that requires additional attention. And it really puts an additional burden on the center to be able to manage that. And as capacity slowed down, we saw different groups that were having access issues, not only children in high poverty areas, but also our kids with disabilities, and definitely our rural areas.
So Sarah, talk a little bit about what did you do in Kentucky to address those access issues as you saw them coming up with those high risk populations?
Well, we've tried different things this year. For our rural areas, in many of them, center care just is not an option. Kentucky is about 90 to 95% child care center based. That's been our primary method. And over the past 5 to 10 years, as most states have dealt with, family child care homes have been closing, people have been retiring from that field, and we haven't seen the numbers going into family child care homes that as big as the numbers that are leaving. So Kentucky has really put an emphasis these past 3 years on trying to do anything we can to increase our family child care home supply. And some of the money that we got from CARES dollars, general funds for the state, we used for startup grants for family child care homes. They were able to apply for a $2,500 startup grant that could buy themselves a business computer. They could, pay for their zoning fees, and increase in insurance, supplies that they needed. And they signed a contract saying that they would care for children and become a certified home for the next 12 months. And if we could help promote that entrepreneurship in some of those hard to reach areas, then hopefully we would be providing a greater base of childcare throughout the state. And right now, family childcare homes are perfect. You've got these small groups where, transmission of the illness isn't as big of a deal. Families can put children of different ages in the same homes. Plus, it provides night and weekend care that you don't get in a typical center environment, because most of our centers in Kentucky run from 6 a.m. to 6 p.m. And you just don't have that night and weekend, especially for our essential employees. I mean, you think of hospital staff or those who are running grocery stores, they don't fit a typical 9 to 5 job. So this was a good balance for them. We've also.
Oops, Sarah, you're popped onto mute there for a moment.
That's okay. We've also tried to do a lot of additional training to support our child care providers to work with children with disabilities. We've started a 3-year TOT series where we're launching a new training every 3 months. And we've done trainings so far that include a TOT for trainers on how to work with children who have extreme anxiety, particularly in light of everything that the pandemic has brought. We just did another one on working, how to support early intervention in the classroom. And then we have 2 more scheduled for this year, one on how to work with families who have children with special needs, because sometimes the parents can be more challenging than the children, as I myself can identify with that as a parent of a child with special needs. And then we're going to follow up with an introduction to autism. So we're doing 4 of these TOTs per year for the next 3 years, because a lot of our childcare providers don't get in-depth training on how to work with children with special needs. And then they're put into classroom settings where they could have multiple children who have very demanding needs. And the stress level can be a big factor on why they leave the classroom.
Interesting. Thank you, Sarah. And it's interesting. I mentioned early on that it feels in a way like we have almost gone through separate chapters of this story that I think were in large part sort of based on different assumptions that we had at different points in time. And so, as we have been looking at these equity issues, I think one of the things that I hear, even just across the 3 states that are represented here, and Beth and Belly, I wanted to let you weigh in on this, is that the equity picture seems to have varied a bit. At least state by state, that the 2 of you represent states where childcare did not close down, and so there remained access at least in a limited capacity across the board, whereas Kentucky was in a different situation, like an awful lot of states, incidentally. The majority of states that actually closed childcare for a period, and obviously when childcare is closed, that does create an access issue for everyone. But I think part of our concern, and Sarah, I want you to weigh in on this as well. Part of our concern early on had been this question of when there is reduced access, and in particular in cases like where states had new group size requirements put into place as a result of public health guidance. So you had a classroom of 18 kids, and all of a sudden now that's a classroom of 10 kids. And so the question that we had early on and have been really trying to watch carefully was, who are those 10 kids? How are states deciding, in a case with limited capacity, which kids get access to service? Is it going to be the kids who are on subsidy and maybe are paying out to centers a subsidy at a slightly lower rate than parents might be paying in cash? Or under the circumstances, with limited capacity, are centers going to be more interested in serving kids who are bringing in that higher amount of tuition? So I think as a blanket statement, I feel like what we have seen is that some of that didn't actually play out. As much of a concern as it was, because there was such a decrease in demand for childcare overall, that maybe that was not so much an issue. As we've talked with state childcare administrators, we have not talked to a lot of folks who have said, boy, we really had trouble placing our subsidy kids, for example. But on the flip side, while this one equity question may not have played out in the way that we had feared, there is this question, Beth, I think you sort of brought this up, that there may have been at some point an equity question of which children have to go back to group care under potentially precarious sort of circumstances, that higher income families and families who maybe are working, parents in white collar jobs who are working from home, may well have helped that capacity on one end by pulling their kids out of group-based care. But then leaving this question of, primarily low-income children for at least a time in the pandemic actually being the ones who did access care. Is that, Beth, is that consistent with sort of how things played out in Connecticut?
Well, at a level, Dan, again, I think there's some paradoxical effects here because, as you said, to Governor Lamont, the most important thing was that we were to be sure there was childcare supply. And given that nothing was closed, we did some things to boost up programs that were serving essential workers. And we did open specific childcare centers for hospital workers. Each of our 29 hospitals had a center that we stood up for emergency care. But we were also worried, and I'm sure some of the listeners on the call were too, how are we going to keep supply up? But once that sort of bipartisan policy center piece came out showing the supply and demand and when parents were going to come back. And we were all checking. We got reports every week about how much space was available. We knew we had enough supply for the demand, but we were worried that any day that could go away. But on the equity side, I think we've learned some really important lessons, and Sarah raised one that I think was a really big lesson in Connecticut. And many of the policies that we started looking at before the pandemic, we were able to really test things out. But family childcare proved to be such a durable supply of childcare, and in terms of equity, parents maybe weren't paying for 5 days a week, 10 hours a day. And as parents were teleworking, it also proved to be a useful tool, so that, you know, some days they might be able to manage it, but other days they couldn't. Now, this doesn't always work out for family childcare providers, but they did stay open. And I think we and other states all made sure they had what they needed. And for example, in Connecticut, we went from 5 staff family childcare networks to 12, where we stood up supports like Sarah talked about. I just want to share a slide because I think one of the biggest, oh, I'm not allowed to share my screen. So Dan, if you can fix that. But my lesson here in terms of equity was, number one.
Well, we're going to share them for you, Commissioner.
Oh, great. I'm just going to the one with the number 4, slide number 4. I just brought these in case I needed them. If you could put it on the full screen, it's easy. It's not always so easy to see the numbers. Or maybe I have. Do I have? No, I don't have the ability. There we go. Okay. The lesson. So families were preferring this, and they were preferring smaller groups. So we really have to listen to what are families telling us at this time. And as Sarah pointed out, family childcare homes tend to be scattered across the state. They're in a lot of childcare deserts, and they had space and they stayed open, but we needed to support them with things like a nurse's line and staff family childcare networks and grants, et cetera. But why I wanted to show you this chart is you can see sort of from the beginning of the pandemic how the numbers came up. But small supports to family childcare homes made a huge difference. It was really hard for centers to turn on a dime because they are large, they had big workforces, and they had some sunk costs. So often it wasn't worth it for them to be open for 20 children if they had room for 100. But the family childcare homes tended to be open. They tended to be in places where families needed access for some of the first responder and healthcare jobs. And we've really leaned into this. And it was a lesson in equity during the pandemic. And for us, we believe we have to lean in even harder after the pandemic and with our relief funds, because we found, again, we've been losing childcare, we've been losing family childcare homes for a long time, and the staff family childcare networks helped stabilize that. But then when Governor Lamont put in an extra $5 million in workforce development funds, and we were able to give small grants to family childcare homes, we were able to open 100 in 2 months. And you know, it's not as much supply as opening 100 centers, but it's 100 programs in neighborhoods that really needed those. They're small women-owned businesses. And now the governor and his team are developing a bond program through the Department of Economic Development, not even us, to help these small women-owned businesses in some distressed municipalities to open family childcare. We're changing some of the rules to allow them to open a family childcare home, or there's a bill to pilot that in a small setting that might not be a home, but that can meet the other criteria. So this has really broken open our view, and you can stop sharing the slide, but that family childcare does help address a lot of the inequities. And frankly, the women who run family childcare homes are making much more money than when they were working in a center, getting $10, $11, $12, $13 an hour. Now they're taking 4 or 5 kids at $300 a week. But they do need the support. So we're really focused on wrapping supports, and we've seen even a little support goes a long way. So I think it's a really great strategy.
Well, no question. I think that, one of the interesting stories of the pandemic has been, I mean, to me, sort of the resurgence of family childcare. That they proved to be more flexible. They proved to be settings where I think families were much more comfortable in the smaller group settings. And I know, obviously Connecticut and Kentucky have done a ton to, with the family childcare networks, Beth, that you're working on, Sarah, the work that you've done to set up new family childcare homes. Belvi, talk a little bit about the family childcare sort of perspective from Delaware. What have you seen in terms of family childcare during the pandemic?
So that is an excellent question for us here in Delaware, because one of the things that I am focused on and have been for some time is our family child care providers. In Delaware, those providers make up the majority of the providers in our state, right? So we have more family child care than we have centers. Now, it may be the case that there are still more children in the centers than we have in family childcare, just because of the capacity, right? So for a small family childcare provider, you can only have 6 children, and then for a large, you can only have 12. But as we all pointed out, family childcare plays an integral part in our early care and education system, right? Because families, first of all, they're less expensive, so families can afford them. They're a more intimate setting, and I can bring my 2-year-old and my 6-year-old to this setting. And then if I work in the healthcare industry or, the fast food industry, I can have care from 6 to 9 at night, or from, 8 to 4 on Saturday, and that's just the reality of it. So in Delaware, we do not have any kind of a formal shared services alliance or family child care network for our family child care providers. And I've been voicing the fact that this is a huge inequity. And if we're talking about stabilizing our child care, and education system, we've got to start to focus on our family child care providers. So with the new funding, I proposed a couple of things. I proposed that one, we implemented an initiative when the pandemic began, where we gave providers what was called enhanced reimbursement. And so if a provider had a certain amount of empty slots, they could apply to be reimbursed for those empty slots if they were not receiving any subsidy or any private pay. But my thought was that how is family childcare benefiting from that? I just didn't think that they were, because again, they don't have the large number of slots that a center would have. And so one of the things I propose is that we, with this additional funding, begin to issue direct payments to our family child care providers. And then we receive data on each month on the number of providers that close and the number of providers that open. And so what we don't know, though, is why those providers closed. So I proposed that we reached out to them, particularly if they're family child care, to say, hey, was this a result of the pandemic? And, we are prepared to offer you funding to reopen if that is something that you want to do. So that's another thing that I propose. But on the larger scale, I propose that Delaware needs to implement the staffed family child care network concept. And I have shared with them the data, the research that correlates quality of childcare with the participation in a network. And, again, in Delaware, family childcare is large, and I think it's going to increase just because of what we talked about. Families don't want their children in these large centers. We've even seen an uptake in the request for relative care. So we're getting a lot of families who are actually leaving centers and requesting that a relative be able to care for their children. So my hope is that I've got the ears of our legislators and our leadership, and that we really begin to focus on our family child care providers. Because again, when we talk about equity, who are our family child care providers? They are minority females. They're small business owners. So if we're talking about equity, that we need to look at that. We need to look at who these providers are, and we need to ask ourselves, are we equitably sharing these resources that are coming into our state? Delaware, this last act that passed, we're receiving $108 million. Now, for some states, that's not a lot, but for us in Delaware, that's a lot of money. And so we are in talks about how we're going to use that money. And I just continue to push the idea of the staffed family child care network. And again, I'm hoping that, we implement it. I've gotten some feedback or pushback, I should say, about, okay, we can start this, but how do we sustain it? And so, my thought is that we have to think about that. That's a next step to take, but we can't ignore the fact that we need to support these providers more. We just aren't doing that here in our state. So that's kind of the picture. That's where we are now. And so honestly, I may be reaching out to you, Beth or Sarah, for some advice about, how you guys are doing this in your state. And, I may need some help convincing people that this is a necessity. It's really not an option at this point, So, don't be surprised if you hear from me.
And, Belvy, I will say the National Early Childhood Funders Collaborative Group, for anyone listening, has been very interested in this. And so you might find that either a statewide or community foundation that focuses on early childhood knows about these. And that's really how we were able to jumpstart them and then ultimately work it into our CCDF plan. But the flexibility of the funding from a foundation at the beginning of COVID really did help us do it quickly. So I just recommend, because they meet nationally, and this is something they actually brought to us during the pandemic.
And that's how we started off in Kentucky as well, as we got a large research and development grant that helped us do some shared services hubs for a 3-year grant period. And then as we transitioned out of that, we're in the process right now of transitioning into supporting that paid family child care network through CCDBG funds, and with a big emphasis on business practice. I mean, so many of us who have grown up in the field of early childhood, we got promoted to administration because we were really good teachers. I was a really good teacher, so then I got to be the boss, but nobody ever taught me marketing and budgeting and all those kinds of things. And so we see this a lot with our family child care homes. These were predominantly women in our state who have been amazing teachers, and now they're running a business, but they've never had to do business taxes, and they've never had to do a lot of these business skills before. And so the network is really there to support a lot of that, to give more individualized training, and to recruit additional family child care homes throughout the state.
Sarah, there's an interesting question in the chat that I wanted to sort of throw to you in part about sort of making the connection between why the existence and strength of family child care helps to promote equitable access for low-income families and for children of color in particular. And I wanted to raise in Kentucky's case, the fact that you have a bit more rural area than probably Connecticut and Delaware. So I wanted to give you a chance to just sort of weigh in on how Kentucky is using family child care, maybe to help. I know as part of your strategy, certainly you're looking at child care deserts in the state, and how family child care plays a role in getting to children in those communities.
Yeah, prior to the pandemic, Kentucky has 120 counties total. Prior to the pandemic, 65 of those counties were considered child care deserts. And we know that since then we've lost child care programs, not as much as we initially anticipated, thank goodness, but we have lost programs. And again, in rural areas, family homes are spaced much further apart in the mountains and in rural counties. So if you put a center in the middle of a rural county, like in Appalachia, you just can't get enough families that can drive and commute to that center for it to stay open. And so, residential family child care homes can get 2 to 3 families and support themselves on that. And especially with subsidy supports and things of that nature, they thrive a little bit better. And we also think, based on the jobs that many families have, in Kentucky, in a lot of these rural areas, we have farmers, we have coal miners, we have people that are doing a lot of hard labor jobs, and they don't work 9 to 5. And so family child care homes have a lot more flexibility to provide for those families. Another aspect of family child care homes is a cultural component. Many centers try to take religion or cultural habits out of the center so that they can serve a lot of different families at once with giving them an equal education opportunity. But in family child care homes, a lot of times cultural traditions and habits are much more in place. And families can really relate to that. They may want a family child care home that shares the same cultural habits, the same types of meals, the same kind of daily routines that their own personal family shares. And it makes them feel safer to leave their children in that environment when they have the same traditions and elements that they would in their own home.
That's great. I want to shift gears a little bit here. I know we've got some questions stacking up in the Q&A, and we're going to get to some of the viewer questions here in a minute. But we've talked a good bit here now about how states are working to promote access for children and families. But there's another really important aspect to this equity conversation in state child care systems, and that relates to the workforce. I mean, Belvy, named that many of the proprietors of these family child care homes are women of color, but the truth is that is true, in many cases across the child care workforce, both, working in family child care homes and in center-based programs. The pandemic has been, I think, a really interesting opportunity in a way. I mean, I think to the, Beth, when you said, one of the silver linings of the pandemic was that, the early childhood leaders in field may be more connected than they have been. To me, one of the other great silver linings, and I think it remains to be seen, how this will ultimately play out, but one of the other silver linings is that the early childhood workforce is getting recognition that it has never had before. I mean, immediately they were lumped in as in the same breath as first responders, with emergency medical personnel and law enforcement, and held up in a regard that frankly the child care workforce has not always been lifted up in that way. So one of the potentially exciting things that has happened here is, I think there's been a spotlight shown on the early childhood workforce and its importance. And I know that all three of you in slightly different ways have worked to kind of think about the needs of the workforce over this time. Beth, talk a little bit about Connecticut and what you have done during the pandemic to support compensation or other supports for the early childhood workforce in the state.
Yeah, it's a really good question, Dan. I wish I could say we'd done more. This is a vexing problem. We certainly put out grants. We ran a program at each hospital, I said, and the anticipation and the contracts required that they give the staff additional pay. And so that was one way. We also did a program that sent centers additional funds, and family child care homes additional funds for each essential worker that they cared for, which helped some with wages. The big challenge here is absolutely, I know my governor understands childcare and its value so much more. I think families understand it. I think they appreciate, those who are home with their children really appreciate childcare providers. But even though they were frontline workers, they were out in front, they still did not make a living wage, most of them. We do have certain requirements in our state-funded programs, but that's 25% of the system. 3/4 of the system is private. And now we have this in Connecticut, $270 million, and we're trying to think about how do we get some of this directly to the workforce. So we're trying to structure grants that a proportion has to go to the workforce. But this is a problem that despite all of our collective conversations, because I know Sarah and I are in common conversations, the most vexing problem is how do we make sure, I keep saying in my place, how do we make sure these dollars get to the people doing the work? When money flies into childcare, Deloitte, coaches, consultants, PD organizations get rich. And the money does not make its way down to this, to me, when I was getting ready for today and you asked, what's the biggest equity issue? To me, this is the biggest equity issue of anything that we're talking about. Obviously, there's equity all over the place, but childcare workers have been subsidizing parents and states and the federal government for decades. And now I just reported to the budget office that we have 111% more money coming through CCDF than we did in 2018. And the problem is the dollars aren't sustainable. And so when we say to programs, you have to use these dollars, we're sending you a really nice grant, you have to use these dollars for staff, they say, well, then I'll have to do a bonus, or I'll have to do this or that, but I can't build it into the base. And so programs, I don't know about Delaware and Kentucky, but the staff shortages right now are drastic. Programs are offering $600 bonuses to sign on. So even programs that have reopened, so we've lost a lot of our workforce at this time, and the pay is still not there. So that is one way, I think one way that Hunt might be able to help, because I'm sorry to jump to the chase, but you said, how can we help with equity? Is I think all states are struggling with what's the appropriate salary scale so that we could say, okay, if you check this box on your grant, we'll give you 25% more money. So basically in Connecticut, if you're in a high SVI community, you get 30% more per child with your grant, because we know you had a harder time and we can measure that. But we've been doing work on wages, and we don't have, we have what is, which isn't a living wage, isn't a professional salary, but we don't have what it should be. Or, I think I so wish power to the profession was already rolled out, because I know that's a big part of the work that Rhiannon and NAUIC are trying to do. And it's really important, but I'm going to try to stop it. I don't know if, just so people know, I got involved with politics because I was a childcare director, and every week, every third week, I'd have a sticky that said, I need to talk to you. My staff were leaving. Ultimately, it got me involved in advocacy, brought me to the Capitol, and I was in the House and the Senate, and now I'm commissioner. So this is the issue that I started on 35 years ago, Dan, and it's so frustrating to see that even when we get this influx of money, the policy complications of getting budget offices and governors and towns and program directors to agree to increase the wages, the policy levers aren't there right now. So I'm open to ideas that are out there, but I'll try to stop. But this issue is so, I just want something to change before I die. I'm at that point now.
Sarah, I know Beth mentioned bonuses. I know Kentucky actually incorporated some bonuses, part of the CARES Act HERO bonuses for the child care workforce. Talk a little bit about how those worked. What were there lessons learned there, and how do you see this current time sort of weighing in on the compensation issue?
Well, we did HERO bonuses while the majority of the child care programs were closed, and we had that small group of emergency centers. There were 800 child care providers that were working during that time period. Now, at the same time, unemployment had that $600 extra bonus going on. And when you're a child care provider, you could make more money on unemployment than doing the hard work involved with changing diapers and writing lesson plans and doing assessment. And we couldn't combat that. We didn't have a way to pay more than all the unemployment, but we wanted to find a way to sincerely say, thank you for the hard work. And so what we did was we offered a $1,500 hero bonus, like a stipend to everybody who was working during that time period. Now, we couldn't send it to each individual person. That got really complicated with procurement and all those kinds of things. So what we did instead, we sent it to the centers, but we wanted to make sure that every child care provider got it. So we had child care aware staff, our CCR&R agency in the state, go out to each center and have every provider sign a sheet with, you know, their signature saying, we understand that this money is coming to us, and we will let the state know if our director doesn't give it to us, because we really wanted to ensure that everybody who was working during that time period, putting their health at risk, working long hours, that they got that money. But again, you know, like Beth said, it was a one-time deal. And even now with the CRISA dollars and looking forward to the American Rescue Plan, I'm so excited about the possibility that we have of increasing wages and decreasing parent costs, but it's got a timetable on it, you know? And so brainstorming through these things, what programs do you put in place that you know could potentially just end in 3 years? You know, directors don't want to give a raise to everybody and then have to fire people at the end of 3 years, or say everybody's taking a pay cut, because they'll lose their staff. And so a bunch of them, with the CRISA dollars, we put, okay, you have to pay wages. A portion of this has to go to wages, and we encourage that you do a raise or a bonus. And directors emailed me about that topic more than anything else when we sent those contracts out. And they all said, can I just do a one-time bonus? I'm scared that I can't sustain a raise. And these are directors who have taken out, they've emptied their IRAs and their personal savings and maxed out their credit cards to keep their centers open. They're not trying to be greedy. They're doing everything they can to keep their program open. And so I get it. They don't have the money for a raise, but they want to. They love their staff. They're proud of them for all of this endurance that they've been through. But how you get that up? I mean, the two biggest problems I see in the field of early childhood right now as a whole is that we're not paying our staff enough, and that parents have to pay too much. So, you know, and parents are like, okay, if I'm paying this much, I'm sure you're making a fortune, talking to the providers. And the provider's like, well, you know, if I only make this, if I only make a little more than minimum wage, then, you know, why are you complaining about the pay rate? But we're comparing it to public school in a lot of ways, where, hey, it's free in public school and you're still getting a good education, but that's not the fragile system that's set up for childcare. And in many ways, our providers suffer, because I think in Kentucky, only 16 to 17% of our providers receive health insurance through their employers. Many of them, you know, because we're a state with a low cost of living, many of our providers make close to minimum wage. Overall, it's hard to sustain that lifestyle, even when you love working with the children.
Delvey, how has the compensation conversation played out in Delaware?
So we have a couple of programs in place. We have the TEACH program, we have the wages program, but we are we've been having many conversations about that, right? Because it's just the reality now that we're facing. So in Delaware, you know, it's the same. Providers have lost staff. And the unemployment compensation is one of the major reasons at this time that they cannot get staff in. But also, I had a meeting with a group of providers who, yesterday I did this, in fact, because I wanted to be in touch with them directly myself. These are providers that provide care for children and families who are mainly subsidy children and families. And so they expressed their fears about, and they wanted to know what we were prepared to do to help them, you know, recruit and maintain their staff. And I really didn't have the answers. You know, we don't right now. We've been in conversations, but we don't have anything concrete in place to address that issue. But I think the bigger picture is, and this is something that these providers shared with me, they're afraid of the increase in the minimum wage. They're afraid that if Delaware has to pay $15 an hour, how are they going to be able to do that? So then the bigger picture is, you know, how do we help these providers be able to support this increase in the minimum wage? You know, do we increase the reimbursement rates? And if we do, you know, where does that money come from? Because that is one of the things that Delaware is thinking of doing. We are thinking of increasing our reimbursement rates, but, you know, for a year, this is something that they've been talking about, you know, because, you know, we're getting this extra money and we may be able to do it for a year, but we may not be able to sustain it after that. And so, you know, I wanted these providers to know that that is something that we were thinking, and, you know, they pushed back. They were like, well, you know, how is that going to help us in the long run? You know, but that is something I wanted to hear from them, you know, so that I shared that with my leadership, that, hey, this may seem like a good idea to you, but providers don't think so, you know, because they're thinking about the increase in the minimum wage. They're also thinking about the big bill that they're going to get at the end of the year at tax season. You know, when they collect all of these grants and all of these extra dollars that we're putting into their programs, how are they going to deal with that large bill that's going to come to them? You know what I mean? So there are just a lot of layers to the workforce, the child care workforce, that, you know, as a nation, you know, we don't have a way to address yet.
And Belvy, if you increase the subsidy rates, we know that in most states, the subsidy families are less than 20% of child care enrollment. First 5-year fund shared that information. So think about the other 80% of families. When those rates go up, there's nothing to offset that cost. Right. I still have pretty young children. And when I had an infant and a toddler that were both in childcare at the same time, I paid $400 a month more for childcare than I did for my mortgage. Yep, right. And, you know, and my family is a middle-class working family. We had steady paychecks, but it was a huge financial burden for us. So if we have to double the cost of childcare, you know, we can increase subsidy, but what do you do for the rest of the families? And that's the majority of the families. So how does that affect the childcare programs?
Absolutely.
Well, you know, Sarah, I do think, and I hear you, but I do think that the state funds do impact the marketplace. Like, we are the biggest purchaser of childcare in the state. The challenge is the same challenge we're talking about with programs. How do you get a governor or a budget office say you can, because that's what we have to do. We should be increasing rates before we increase access to deal with the salary and inequity. But it's very hard to get a governor. I mean, our governor says, all right, what happens at the end of 2 years? Once you increase rates, it's not like you can go to 80% of market rate and everybody's living on that for 2 years. And then you say, oh, sorry, this funding's gone. And so I think the most important thing is that we get clear signals from DC, which there are certainly more than smoke signals. There are signals that they're looking at long-term opportunities to fund childcare. And I believe that the sooner we get that signal, the better we'll be able to use these funds, the ARP funds, the American Rescue Plan funds, to make the kind of systemic changes that will lead to long-term quality improvement, connections with schools, all that. So I do think it's an urgent issue. Otherwise, all these dollars are just going to go out in grants because that's what we can do. And we won't make the kind of structural changes related to salaries that we need to make, or teacher requirements to meet power to the profession. So a lot of this just depends on what comes out of DC. So that's another way that the Hunt can keep us updated about what they're hearing. And I think all of us are on sort of pins and needles about what does UPK and childcare mean. Like, anywhere I go, I say, universal childcare is universal preschool, and universal preschool is childcare. But I don't feel like these two are married in the eyes of the administration, which is fine. I mean, I think it'll work out, but I think we all have a job to do to help make that happen in a way that leads to the most equity for families, but that helps our workforce finally get what they deserve. That has to be at the core, and it can't be at the core if we don't have sustained funding. So then that opportunity is lost.
Just a couple minutes left, and I definitely do want to try to get to at least a couple more questions out of the chat. One of them is, you know, very pertinent to equity issue that we haven't talked about, relates to the access to health insurance for the child care workforce, which has just been such a tough nut to crack all over the country, but especially highlighted during this time, as public schools have the ability and or the political clout to have closures during this time. I've said often the risk really wasn't mitigated; it was shifted onto a different workforce, that is less compensated and frankly less likely to have even paid sick leave, during a pandemic. So I'm just curious, any of the three of you had a chance to do anything, or are you thinking toward any uses of the current stimulus funds to try to tackle this thorny issue with healthcare?
One of the things, Kentucky has a very expanded Medicaid program. And because of the expansion, many of our child care providers could qualify for Medicaid and they're not even aware of it. Like I said, less than 20%, around 16 or 17%, maybe 18 if we're really pushing it, of our child care providers are offered health insurance through their job. Some have health insurance through a partner, a spouse, or a parent still, but a lot of them don't have that background. So one thing that we've done at the Cabinet for Health and Family Services is we worked with our Medicaid department, and they have made a concerted effort in the past month and a half to reach out to every single child care program in the state and share with them about the expanded Medicaid package and let them know, hey, a lot of you may qualify and this can enhance your benefits. It's already available. It's not something that we would have to use CRISA or CARES Act money for. You need to know that you can qualify for this and that it could be there for you. I mean, we have initiatives all over the state where, of course, the COVID testing is free and the COVID vaccine is free. But if you're getting sick and you have sustained medical bills, you need to have healthcare in place. And Medicaid is an option that a lot of our child care providers don't think about because they are employed and they think, oh, that's only for people that maybe they don't have jobs or they have other circumstances. But we have made a really concerted effort to reach out to every child care program, send out flyers, make sure that those flyers are in places child care providers will see them, and to just let those directors know that you need to let your staff be aware that this is a benefit that they could have.
Yeah. So,
well,
I will say in Delaware that again, this is a topic of conversation. And I do know that we have, that is kind of one of the goals in our strategic plan, that all providers have health care and that they are able to provide it for their staff. But this is just something that Delaware has just begun to have conversations about. And we do know that we can, use some of the appropriations that we've received for that purpose. And so again, that's another plan of mine, to have some conversations with leadership to say, hey, is this something that, we want to initiate right now that we have this funding? But I know, the pushback will be, again, sustainability. How do we sustain that for, over, in Delaware, we have over 800 childcare subsidy providers. So again, just a conversation that we need to have in Delaware.
I would just say, Sarah, what a great idea. I think we'll have, when United Way reaches out to our providers, we can take advantage, because that's a whole nother part of the package. But thank you for sharing that.
That one was not mine. Our secretary pushed that. But when I went to him and said, hey, we need to use some of this money for healthcare, he's like, but we have it. We need to utilize it. We need to use this when it's already available and people just don't know about it.
So as we close up, we've got about 2 minutes left. So time maybe for a short answer from each of you to a closing question, which is, we have, we've been through a year of pandemic at this point. As I mentioned, the workforce has been lifted up. I think the needs of children and families have been focused on, in a way maybe never like before over the past year. We've got $40 billion new dollars coming down for childcare across the country. What is your greatest hope for how we might create more equitable early childhood systems as we go forward?
I'll go first because I have to hop off because I have a meeting. But
Sure.
my greatest hope is that we listen to families more and build systems that meet expressed family needs versus build systems around systems that exist. I think we're living in the 90s. So I think that's what I hope.
Commissioner, thank you. I know you have to jump off for another meeting. We appreciate it. Belvy, how about you? What is your greatest hope here as we re-envision what childcare might look like going forward?
My greatest hope is that states are begun to be held accountable. There are billions of dollars that go into Head Start, that go into Early Head Start, that go into CCDF, and we continue to see the same results with our children, the same disparities. Nothing is changing. Although there's more money being circulated, the statistics are remaining the same. And so that means to me that states that are receiving these billions of dollars are not being held accountable. So that is my greatest hope.
Sarah, we'll give you the last word. What's your greatest hope?
My greatest hope is that we can continue to bolster the workforce. I want our child care providers to make a wage that is comparable to the work that they do. I want them to have the support that they need to do their job well, whether it's additional training that they need, or whether it's the health insurance or access to paid time off that they need. And I pray that we can use these funds in a way that we can support them in an equitable way, that they want to stay in the field, and that we can maintain that progress beyond the next 3 years.
Well said. And Sarah, while we're here, I know this is a webinar and not the Tonight Show, but it's not often that I get a guest where I can say you have something to plug. So I know you have a new book coming out. Will you want to take a moment just to share?
I do. I have a new book coming out at the beginning of May called America's Child Care Crisis, how to sustain an essential industry. And I'm very excited to talk about a lot of these issues within that book, how our providers don't get the support they need, how our parents are stressed, and all the different ways that we need to look at system changes and infrastructure in order to make this industry last for as long as possible.
Great. Well, I'm sure looking forward to reading it. And I want to thank you, Sarah, for joining us, and Belvy as well, and Commissioner Bai. It's been a great conversation. I knew this hour would fly by, and it certainly has. So thank you for taking the time to be with us, and look forward to many more chances to collaborate and continue this conversation with both of you and with Commissioner Bai as well. Before we wrap up, I did want to just mention we have another great early effort session coming up on the 6th of April. We're going to be focused on the question of how to transition children back into school after a year of quarantine. We know that there are tens, if not hundreds of thousands of children who have redshirted out of kindergarten and pre-K programs during the pandemic year. And so we are looking at the possibility that school systems will see a real sort of tsunami of kids coming in, that we may have, 125% or 130% of what we would normally expect to enroll in kindergarten and pre-K next year. And so we're going to be talking about that transition and what it's going to mean to support kids who maybe haven't been in group care, as we've been talking about, or in group settings with other children. Dr. Laura Bornfriend, the Director of Early and Elementary Education from New America, will join us. Dr. Kathy Gaston, who is the actually Executive Director now, no longer interim, at Friends of Children of Mississippi, and Dr. Sharon Pepakai, who is one of the leaders actually in the AASA early learning cohort. She is with the Appoquinimink School District in Newcastle, Delaware. I'm so proud that I said that this time. That one's a tongue twister. So we are really looking forward, though, Tuesday, April 6th. It'll be at 2 p.m. Eastern. We hope you can join us for that session as well. As always, thank you for taking the time to be with us. We know your schedules are busy, and the fact that you come and participate in these conversations as viewers really means a lot to us. So thank you again for being with us, and we look forward to seeing you on April 6th for the next edition. Thanks, everyone.